And it's all free. No ads, no big companies, no spam. It's all free. Kids have fun, win prizes, recite on TV. And we're coming to you almost live all the way from our studios here in Southern California. I'm Yusuf Estes, and we have a special guest with us, and I'm going to introduce him right now. We have, wow, look at this cool shirt. The blue shirt, black cap, Dr. Sultan, all the way from St. Louis, Missouri. Salam alaikum.
Walaikum assalam wa rahmatullahi wa barakatuh.
Once again, doctor, you're not wearing your mask. Oh, my God.
I'm a poor man. My poor man mask God gave me. I use it. When I sneeze, I put my hands on it. No, I'm just kidding. There's nobody in here, you see. So,
So you're saying that a poor person could just go like that and then sneeze, achoo, and then put his hands all over everything? No! I don't think so.
Right now, in social isolation or social freedom. Nobody's around me. I can do whatever I want.
Social freedom. Wow, that is so cool. You know what? This mask is really bothering me to wear it. And I don't have anybody within 10 feet of me right now. And the only other person in the studio is half asleep anyway. I don't think he's going to be moving anyway. Hello? Yeah, I think he's out. All right. So can I remove this?
Certainly you can.
Oh, thank you so much. Oh, that feels much better. Thank you so much.
That's now I know where all the masks go.
Oh, you know what I mean? I can take this one off too? Oh, wow. Thank you so much for that. I really appreciate that so much now. Yeah, that feels better. Thank you.
Yes.
That's really cool. All right. Yeah. Alhamdulillah. Alhamdulillah. Tell us a little bit about what's going on, Doctor. We really like to know. Are we making any headway here? Is it getting better some way or shape?
No, we are not getting headways. I mean, someplace a little bit, you know. Yesterday, there was a new U.S. record, 77,250 new cases.
In the world, right?
No, in USA.
77,000?
Yes.
Oh, wow.
That's point number one. And we approached close to 1,000 deaths yesterday, which is exactly 9:43, you know. And there are a couple hours ago when I checked, it was 14.1 million people affected all over the world, you see.
14 million?
Yeah, exactly. 14.1 million.
Okay, doctor, I have a question. Are you still giving me some stats? I want all the stats before I ask my question.
Okay.
Go ahead.
Then there are right now, there are 3.6 million cases and 138,649 deaths so far, you see.
Where? In the world, right?
No, in the USA.
This is USA.
Yeah, 3.6 million cases and 138,649 deaths so far, you see.
Okay, what else? What else you got?
Well, now, number 2 in the world now is Brazil with 2 million cases, and India is number 3 with 1 million cases, you see.
And what country is number 1?
USA. Do you think we should be defeated in any field?
Well, I think we need to write to the White House and ask them this. We didn't want to be number 1 in everything.
Yeah, exactly.
I mean, I am happy that we have some, unemployed people who are working now, and I heard about that. And I also heard that our military is doing pretty good, and things like that. But I don't want us to be number one in the pandemic.
Exactly. But that's so we have to have our intellectual capacity put in place to see how we can become number last in the world. You see.
Okay, I want to ask my question now,
Yeah.
if I could, because the numbers that you're giving us, that in the increases and so on, um, we heard from some people are saying that why this we are paying too much attention to this pandemic because it's not really a pandemic. I heard that from a Muslim just the other night, and they were telling me, and then it was reiterated by some other people, that there are more cases of regular flu on an annual basis, more cases of death to tuberculosis on a regular basis. Are these numbers that really in the way they said it? It seemed like we were overestimating everything. Maybe they're wrong though. They're not doctors.
Well, it is just how you want to perceive the number, or how you want to deny the truth, and how you want to deny the facts. We got the numbers in here. We are not comparing apples with oranges. What we are talking about right now is coronavirus, which is acutely fatal, and with a lot of other complications associated with that. And it is how sad it is that if you get I'm not comparing with flu, but let's say, put it this way, you get a flu virus and somebody gets a flu virus and dies. Yeah, I mean, one death is too many deaths. And when you put in the last few months, 138,000 people dying some places, we are running more places, I would say, and we have never had that kind of a crisis. At least 50 years I've been in the United States. So I mean, the case of flu happened, this happened, that happened, tuberculosis happened, but people do not die so acutely, so unexpectedly, because now relatively healthy people not only getting this, but they are dying also. One of my, he's not my colleague, but much junior than me. He was a vice chancellor of a medical university in Pakistan. He just died. It was a very famous surgeon. Died. He was perfectly good health, no problem. Maybe about 60 years old, and he got the virus and died in 28 days. You see, he was talking to his friend the other day that because he was at the forefront taking care of people. Corona caught me too. You see, so laughingly, and in about 28 days or 23, whatever number of days, he died, and he was in just good health. So this is what we are talking about, which is so unique to this coronavirus than other flu and etc. things. So you cannot compare apple with oranges, and that's what we need to realize. Even in the United States, a lot of people are denying the presence. Like my patient came to me the other day. I talked about the other day. She said, "Do you think it's for real?" God, it is for real. It is for real. Take it seriously, and just pray to Lord that you don't get it. I don't mind getting flu, but I certainly not pray for coronavirus, which with so much complications and so rapid downhill slope, from that. Please take it seriously.
Well, we have to take it very seriously, because almost everybody connected with us right now has a very compromised immune system. We have Well, I'm almost an octogenarian. You know what is that? Octagon is that's 60s, 70s, 80s. I'm almost 80 years old, so I have to be very careful, right?
Absolutely.
I think
No,
I think you're about the same age as me, right, Doctor?
I'm junior to you.
Yeah,
I,
you're.
I'm 74.
Oh, okay, that's right. You're just a kid. All right, I
No,
got that.
that's right.
Alhamdulillah, alhamdulillah. Yeah, and but I wanted to focus on something right now that just because you have a strong immune system still doesn't mean you're not going to get it. Is that's what I've heard? Is that true?
That's absolutely true. Even young people who are supposed to have good immune system, they're getting. But you know, the thing is, the younger people, most of them, the problem is not serious. They get over with it.
Yeah.
But it is the people with chronic illness, heart problems, lungs problems, diabetes, hypertension,
Don't
cancer,
leave out asthma.
and asthma. Yeah,
Yeah. Or allergies. Somebody has a lot of allergies. That's also a compromise.
exactly.
One of our young brothers, I've known him since he was 10 years old, came with us last night, and he was really being careful because his immune system is compromised by both asthma and allergies to everything. So, yeah, he has to be very careful. We have somebody on the phone, Doctor, by the way. We have, I was making it kind of delay so you could finish what you were saying, but Salam alaikum, Kim's Fish. Go ahead, sister. Go ahead. Well, maybe I lost her.
Me?
Sister, go ahead. Oh, I got to turn it on. Oh, I forgot to turn this. Yeah, here we go. Salam alaikum. Still not working. It's on.
No, it's not.
No? My phone is working, but the speaker thing isn't. Salam alaikum, sister.
Come assalam.
There it is. All right. Yeah.
Yay!
We have Sister Kim from South Dakota by way of Arizona.
I had a question for the doctor, if you don't mind.
Yes, go
Yeah,
ahead,
please.
sister.
I was wondering, doctor, what your opinion was on the development of the COVID vaccine, considering that there have been numerous cases of people getting the coronavirus, recovering, and then getting it again in 3 months. Do you think the coronavirus vaccine is going to be effective?
Are you serious? Is that really happening?
Yes.
Doctor.
Well, yeah, good. Kim, very good question. First of all, you took words from my mouth, because if she had not stopped me, I would have brought the good news coronavirus, and that is that the vaccine trial is about to get started. That's point number one. Yes, there are cases of recurrence of coronavirus, and we're still in the learning phase. Yes, you're right, and there are cases, but what is the real incidence that's going to be? That will only the time will tell. And will vaccine be effective? Well, just like anything, when you try, there's going to be some failure, there's going to be some success. You're going to learn from your experience and try to come up with a vaccine that works. That's all, you see.
Well, the latest on the internet from the, what's it called, the Center for Diseases or something like that. What's the name of the center?
CDC, Center for Disease Control, CDC.
CDC. Okay.
Right.
Nothing to do with CDs, right?
No. And nothing to do with DC either, you see.
Yeah. Oh, well, anyway, it says, but I'm going to tell you this last update was April 24th.
Okay.
Okay. And here we are, we're on the 17th of July. But at that time, it said there were no known vaccines for the the disease at that time. But now, okay, that was April. So we have May and June and July. And hello, that's 3 months ago. So is there something really that could be considered a vaccine for it right now?
No, not right now, but the clinical trial about to start now.
So the information our sister was, Kim, give us that again. You heard that there was a vaccine already there and that they were trying it out and people were getting it 3 months ago. What is that?
No, they did not. I didn't mean to imply that they had a vaccine out.
Oh.
I knew that they were testing vaccines. There's one that's showing a lot of promise that is going into clinical trials right now, but it's still several months away from being released to the general public.
Okay, but where is that going on?
I don't remember the name of the company. It's here in the U.S., and it's a joint effort between a private company and the Centers for Disease Control, I believe. But it's a U.S. vaccine.
All right, but you don't know what country where they're doing that, right?
Well, they'll be doing it in the United States. They'll be doing it in the United States.
Oh, we're going to be doing something in the United States.
Yeah, that's my understanding. Yeah.
Okay. Actually, I don't think it would be very valid if it's being done in another country anyway, because the United States wouldn't approve it. Because if you're a doctor anywhere else in the world, you come to the United States, forget about it. You're not a doctor anymore.
They've been looking at some other promising ones coming out of Australia, and Australia is a country that we have a very good medical partnership with. And so if something was developed in Australia and we could replicate the results here, we'd probably use it.
Your comments, doctor?
Yeah, I don't know. The only thing I know is that the vaccine trial is about to start here. And beyond that, how the coordination between Australia and the United States and other countries work, I have no idea. Because FDA is very stringent in here, and does not approve things easily. And vaccine being available in the next few months, that is a really big push. Otherwise, it takes years to develop a vaccine and go all the clinical trials and double-blind studies and on and on. So it takes quite a bit of time. This is on an accelerated track right now, and I think we really need a vaccine on an accelerated track. But until we get the vaccine, we got to have a personal responsibility of taking ourselves. And even when the vaccine is available, you don't say, you can smoke and breathe and eat anything you want because you've got a vaccine, so we don't have to worry about social distancing, don't about this, personal hygiene, personal cleanliness, blah, blah, blah. We don't have to. No, we still have to take the common sense approach first. You see?
Okay, I did find something. I'm going to put it up so people can look at this. It says the first COVID, let me see if I can find, yeah, here we go. The first COVID-19 vaccine candidate trial begins in Australia. This is dated the 2nd of July, so that's 2 weeks ago. And it says the first volunteer in trial receives the new vaccine at the Royal Adelaide Hospital this week. That must be in Adelaide. Oh, wow. Did you know about that, doctor?
No, I did not. No.
Oh, okay.
Well, there's so much to catch on with it. every day. But
Well,
but
I
the,
can
the, the things are
continue.
developing very rapidly. Yeah.
I can continue reading if you want me to. Let's see. It says the global data is free biweekly. Oh no, that's just a report. First clinical trials of a COVID-19 vaccine developed in Australia commenced at the Royal Adelaide Hospital's PARC Clinical Research Facility. It's named. Whoa, I jumped ahead of myself. Whoa. Yeah, here we go. The first clinical trials. Yeah, okay. It's called COVAX 19. COVAX. I don't know. Oh, corona vaccination. Yeah, okay, I get that. Targeted vaccine developed by a company, vaccine and researchers, Finders University. Says during the first part of the trial, 40 pre-screened candidates between the ages of 18 and 65 were given 2 doses of the vaccine or placebo, 3 weeks apart. The aim of the trial is to assess the COVID-19's vaccine initial safety, immune response, production, antibodies, and other immune responses will be analyzed. I lost my place. 2 weeks following the second injection. Blood tests be performed to determine protective antibody and T-cell responses. Says the trial principal investigator, Professor David Gordon, says, this COVID-19 vaccination has already shown promising results in animal models. How do you get a model of an animal? Anyway, it's exciting to him, I guess the animals modeled example, I don't know, to take the national breakthrough to human trials in Adelaide.
Now, see, the one I'm referring to is that the first COVID-19 vaccine test in the US revved up people's immune system. And it's not the animal model, just the way scientists had hoped. The researchers reported Tuesday as the shots are poised to begin key final testing. No matter how you slice it, this is a good news. Dr. Anthony Fauci said that.
All right. Well, let's see. Is that the one that says COVID-19 testing problems started early?
No, this is, I'm referring to Associated Press News.
Oh, okay. This one,
July 14, 2020.
Yeah, this is Modern Healthcare. It says that the COVID-19, well, that was back in May, so it doesn't apply, does it?
Yeah.
How can we get more up-to-date reports on all of this? That's a good question, isn't it?
I'll be bringing up as much update information I can bring.
Yeah. So
this is one of the subjects we frequently talk about, almost daily we talk about, because this is the mind of everybody right now.
Wow. Yeah. I think that all of us agree that we'd like to know more about what's going on, even if the people who consider that it's not real, we're still all in the same shape. We'd all like to know some more reliable and up-to-date, especially up-to-date information.
That's one thing that is a true shame, that many countries have a web portal where the public and reporters can log in and see nationwide data in real time. And that's something that has not been very well developed in the United States, where here states and counties are all reporting their own information at different times. It has to be collected by many different places, the people keeping count of the number of cases is Johns Hopkins University, where the infection rates and things like that have been with the CDC, and it's very difficult to get all that information in one place in the United States. And I think that we would be very much helped if we could get one specific site that we could all go to.
Well, I just now I found something, and I think Doctor probably could verify this one. It's the CDC website. Is that a good place to go, Doctor?
Yes, that's a very good place to go. And is also another excellent place to go.
It says 3,005,555 877 total cases. Is that accurate, Doctor?
Yeah, no, I talked about a couple hours ago. It was worldwide was 4.1 million cases. You see.
Wow. So this is not even up to date, is it? Well, it says July 17th.
Numbers really don't matter as long as we are approximate. What do you do with the numbers? They use whether it is this number or that number. The point in here is what the conclusion draw from the numbers is, and that we are not out of the woods. This is progressively increasing, and we have to be extremely cautious and do the best what we can. You see.
Okay. Another question I guess it says here total deaths. What did you say the total deaths were?
The total deaths. I'm not going to all the world. You see, I'm reporting seven. I reported just yesterday 943 deaths and overall 138,649 in the U.S.
Okay. Yeah, well, it says here 926 new deaths just today.
Yeah,
if you got 1,000 people a day dying from the same thing, that doesn't sound to me like that's the flu, or that doesn't sound to me like that's like regular tuberculosis. But I don't know. I don't know numbers. Do you?
Yeah. Well, give me an example of so acute deaths and country running out of the beds and country running out of the mall places. You see, forget about everything else. You see, we are having a problem in having enough staff to take care of all these people. We never, I mean, at least to my memory, there has been no incidents like this in the last 50 years, or almost 50 years that I've been in the United States. You see.
Well, the Dakotas and also Wyoming, and let's see, Montana, Wyoming, and the Dakotas are like the lowest. Well, Maine. Looks like Maine is having the lowest reported cases of all the United States. Maine and the Dakotas. The South Dakota's a little bit more, but 0 to 1,000 in Maine, and in Vermont. I don't know. Maybe we should move. What do you think about that?
I don't think you should move to South Dakota. I still get the news from there, and the town that I used to live in has been hosting fire hydrant parties in parks, and so they're bringing large groups of people together, and they're all playing in the water, and they're not doing a lot about social distancing, and so I would not be surprised if they had a spike, especially when the school year starts.
Oh boy. Yeah, South Dakota. Whoa. It's supposed to be lower than the rest of it. It said they already had 7,694 cases. Ooh.
They had a very large problem with mass outbreaks in meat production facilities in the southeast part of the state, where it was Smithfield Foods, I believe, and something like more than half of the workers all tested positive in the same week.
Guys, we
But
got to
that was
take a break right now. So let's take this quick break and tell everybody when we come back in the second half of our show, we'll be on for another 30 minutes. And the second half, because, we don't just FYI, everybody, I didn't announce this. I should have started the program saying we will not be on for 2 hours tonight. We'll just be on for 1 hour. And when we come back, we're going to be really focusing on our children reciting the Quran. So everybody stay tuned, stay guided. We'll be right back with more. Assalamu alaikum. Hey kids, come join the fun and win prizes too. Guide Us TV is our voice all across America. But now your voice can be heard too. Reciting the Quran. Yes, kids recite Quran, record, upload, share, enjoy, and win big prizes. First prize is $1,000. And the next 10 each get $100. And everyone who enters wins a gift. And it's all free. No ads, no big companies, no spam. It's all free. Kids have fun, win prizes, recite on TV. Mom, Dad. Assalamu alaikum rahmatullah. We are back and you're watching Guidance TV. And right now we want to turn this over to our youth. In other words, this is your time. Yeah, guys, you can call in right now and upload your videos on Recite on TV if you like, or you can just call us on the phone. The phone number is right here, 1-800-971-4383. And when you call in, you can recite on TV. Yeah, man. We have a caller already on the line, but as far as you calling in, as soon as you do, we'll prioritize it and take your call right then, all right? Sister Kim, Salaam Alaikum.
Wa alaikum assalam.
How's everything going there in Arizona?
I had a wonderful day today. I went to my pharmacy to pick up my prescriptions, and I met my first Muslim since moving here.
Wow. Yeah. Tell us about it.
Well, I asked her if I could ask her some questions because Yuma is supposed to have an Islamic community center, but I could not find anything online about it. And she confirmed that we do have an Islamic community center here. It is not open right now, and they don't have a very big online presence, so it's not surprising I couldn't find any information on it.
Oh, okay, but they do have it.
They do have it, and she told me where it is, and I'm going to drive down there in a few weeks and just look for a sign on the door to see if they're open, and we'll see what happens. Inshallah.
Oh, that sounds fantastic. That really does sound good. So, I'm glad to hear that. Very glad to hear that. Whenever they have it, though, what do you think? Will they be able to? Did she talk about how they will do the social distancing and things like this?
She didn't talk about it, and I don't know anything about the design of the building, how big of a prayer room they have, or how big of a woman's room they have, if they have a babysitting room or anything like that. I don't know any of that yet. And she didn't have any information on their reopening. All she knew was that it was still closed.
Oh, okay. Well, at least this is good information for us, isn't it?
Yes, it most definitely is. That
All
was
right.
one of my main priorities.
We got a caller.
when
I got to take it real quick.
Okay.
Here we go. Here we go. We have
Hello, Mahid Hassan.
Salam Alaikum.
Assalamu alaikum.
MashaAllah. Who is calling me right now?
My name is Dahir.
Okay, how old are you, Zahar?
I'm 8 years old.
Wow. Okay, so you are about in the 3rd grade or something like that, right?
I'm about to be in 3rd grade. I'm in 2nd grade. When the coronavirus finishes, I'm in 3rd grade when the virus stopped.
Hey,
And
you
it
know what?
stopped from November.
You know what?
What?
We should just tell everybody you're in the 3rd grade, because if it was open, you'd be in the 3rd grade, right?
Mhm.
So you're 3rd grade. All right. How
Yeah, I'm
about that?
3rd grade.
Okay.
Mhm.
Would you like to recite for us on TV, or you want to ask a question about how to upload your video or anything?
Like upload, share, and the other things.
Yeah. You know what I'm talking about, right? Have you already uploaded a video?
Yeah, how do I upload, share, and that other thing?
Well, you can just tell people where it is. Yeah. Just tell them to go there on reciteontv.com, and then they'll be able to find it. Okay?
And click on watch videos.
Okay.
Click on, tell them watch videos. There's let me see if I can pull it up for you and just show you. Hold on a second. Recite.
I'm so excited.
Me too. I'm very excited. Yeah, let's see if we can show that. Yeah, here we go. There, this is showing us some of the kiddos, and we'll click on the watch videos. Okay, yeah. What is your name?
My name is Daher.
Spell it for me.
D-A-H-E-R.
Say it again.
What? My name is Daher, and to spell it is D-A-H-E-R. A capital D.
Capital D. All right, I'm looking for it. I'm going through all of these. I didn't find it. You already uploaded it though, right?
No, you didn't upload it yet.
I didn't upload it yet.
Oh, okay. That's why I can't find it. It's not there yet. All right.
So how do I upload it?
Okay, when you go
Oh, my
to
dad's
the
gonna
website,
My dad's gonna show you. Not me.
yeah, when you go to the
You're
web,
gonna show.
all right, when you go to the website, at the top of the website, it shows you home, watch videos, rules, be on Guide Us TV, upload your video. So when you click on the upload your video,
Blue button.
it will show you what to do. It's real easy. You put in your email address and your password. If you're not already a member, you can register. Right below that, it said register. And then when you do that, let me put it up on the screen and everybody can see that right now. There you go. So that's, I put my email in and my password and everything, and now I can click log in. Now, if you don't have a login already, then what you can do is go ahead and register, all right? So, and now I'm seeing all of these different videos, and you can click and see different people reciting.
Blue button. Click on the blue button.
Yeah, there is a blue button. If you see it, it says start here. So click that.
And we press it.
Yeah, you click on the start here. And mine, I just clicked it, but it said I'm already logged in. Of course I am, you know. So that's how you do it.
Because you created it.
No. Just because I'm a member. Okay,
Oh.
Dr. Sultan is back. Let's give him a big salam while he's here. Salam alaikum, doctor.
Walaikum assalam wa rahmatullahi wa barakatuh.
MashaAllah. We love having you with us, and we have a caller on the line right now. His name starts with a capital D.
Caller?
Huh?
Am I your first caller?
You are the first caller for reciting tonight, yes. Would you like to recite something for us?
He thought you said scholar.
Ye-
Yes, that's what you said, scholar?
Caller.
yes.
Yes.
Alhamdulillah. Alhamdulillah. What would you like to recite for me tonight?
والشمس وضحاها.
وَالشَّمْسِ وَضُحَاهَا. Let's see, where is that? Number 91. All righty. Let's see if we can put that up on the screen. Ready to go? أعوذ بالله من الشيطان الرجيم.
بسم الله الرحمن الرحيم. والشمس وضحاها والقمر إذا تلاها والنهار إذا جلاها والليل إذا يغشاها والسماء وما بناها والأرض ما طحاها ونفس وما سواها فألهمها فجور تقواها قد أفلح من زكاها وللخاب من دساها.
كذبت ثمود. Go ahead. Yeah, go ahead. كذبت ثمود بتقواها.
That's all I know. That's all I know.
Oh, okay. I thought maybe you were stopping because we have a rule about the first 10 ayahs or something like this. But in this case, anyway, let me ask you a question now. Do you know the meaning of what you just recited in English? Yes or no?
No.
No?
No.
Would you like to know the meaning of it?
Yes.
Okay, because we can put this up and we have a button that we can push and then just listen to it. Would you ready? And it will give you the Arabic. This is going to give you the Arabic, and then it will give you the translation, and it's all audio. You can just listen. Would you like to do that?
Yes.
All right.
بسم الله الرحمن الرحيم والشمس وضحاها
By the sun and its brightness,
والقمر إذا تلاها
and by the moon when it follows it,
والنهار إذا جلاها
and by the day when it displays it,
والليل إذا يغشاها
and by the night when it conceals it,
والسماء وما بناها
and by the sky and he who constructed it,
والأرض وما طحاها
and by the earth and he who spread it,
ونفس وما سواها
and by the soul and he who proportioned it,
فألهمها فجورها وتقواها
and inspired it with discernment of its wickedness and its righteousness.
قد أفلح من زكاها
He has succeeded who purifies it,
وقد خاب من دساها
and he has failed who instills it with corruption.
كذبت ثمود بطغواها
Thamud denied their prophet by reason of their transgression,
إذ انبعث أشقاها
when the most wretched of them was sent forth.
فقال لهم رسول الله ناقة الله وسقياها
And the messenger of Allah said to them, "Do not harm the she-camel of Allah or prevent her from her drink."
فكذبوه فعقروها فدمدم عليهم ربهم بذنبهم فسواها
But they denied him and hamstrung her. So their Lord brought down upon them destruction for their sin and made it equal upon all of them.
ولا يخاف عقباها
And he does not fear the consequence thereof.
بسم الله الرحمن الرحيم.
MashaAllah. Did you understand everything that he was saying?
Yes.
Okay, well, the importance of reciting the Quran is to be sure that we know what it is we're reciting. Then after that, to get it right, to memorize it, and to, pronounce everything correctly, the tajweed. But the very first thing is to understand what it means. So do you know the Arabic language yet?
A little bit, because
Okay.
my dad
that's
taught
good.
me. My dad taught me to do some of them, like others, like Quran and maybe other stuff. But I don't know everything in Arabic. I know a little bit.
Well,
Like
you're
the
doing
alphabet
really
and
good. You're 8 years old and you are doing really good. I listened to you reciting those first 10 ayahs of Shamsi. And I really expected, I didn't expect this much from you, but you really did very good. I think that your dad keep helping you with this, especially right now during this time. Is your dad home a lot right now?
Yes.
Good.
And my dad is my dad. Stay away from my dad because my dad has the virus. He's not dead though.
I'm glad he's not dead. Where is he right now?
He's sitting on my bed. He's living in my bed until the virus wears off. And my mom's sick, but we don't know if she has the virus. But I think she does.
Ooh.
Because she's telling us to stay away. So I think she is sick. I don't know.
How many children are living in your house?
Only two. Me and my little sister.
Okay.
My sister, she's 2 years old, and when she's 3 or 4, she goes to school.
That's
and I'm
good.
8 years old. Yeah, and my sister, Lily's a toddler now. Her name is Lily. And my
Lily?
dad's name is Aboud. And my dad's name is Aboud, but his actual name is Ahmed. But you can call him Aboud. And my mom's name is Ahlam.
MashaAllah.
I'm just telling you that for you know their names.
Oh, well, that's very good. You're very, very smart. And if you didn't tell me you're 8 years old, I would have guessed you were 10 years old. I would have thought that, yeah, you're 10. I would think that. Yep. So,
Thank you.
well, I think you're probably taking care of everybody, aren't you?
But
Yep.
most is my sister because she runs around and breaks stuff. She is 3 things bad.
Well,
She
you know,
bites.
when they're 2 years old, they're supposed to run around and break stuff. You know that, right?
Not because she's a toddler now. We didn't teach her that much because we didn't understand that much.
MashaAllah. Well, let me ask you a question. If your dad is sick and your mom is sick, who's taking care of everybody?
My mom and dad still, but they just told me what to do. I just asked them, but through the door, and I sleep in our basement.
Okay, where do you live? What state?
I live in America,
Okay.
the USA,
Okay.
Michigan, USA,
Okay.
and
Are you close to Detroit?
My street is Helen Street, and we live in Dearborn.
Oh, Dearborn. Yeah, you know, but
And
my father was born
and
right close to Dearborn in Ann Arbor. Yeah, yeah. His birth certificate said Dearborn on it. Yeah.
one of my family lives in Ann Arbor.
Oh, really? MashaAllah.
Mhm.
Well,
And our house number is 4717.
whoa. Don't tell everybody on TV right now where you live. That's not a good idea.
Ooh.
Yeah.
Okay, I'm just gonna. How about you just delete that part?
Well, no, you can leave it on the when you're filling out the form. We need that so we can contact you, but don't say it on TV because right now about 2 million people are watching us on TV right now.
Oh, sorry, but I'm just gonna pretend that I didn't even say it.
There you go. I'll pretend you didn't say it too. How about that?
I pretend I didn't hear it.
Yeah, there you go. And Dr. Sultan, he said that he's going to pretend that he didn't hear it. So there you go. We all got the pretending down pretty good, right? MashaAllah.
When does the when does the voting to get the prize?
Okay,
is tomorrow?
that's a really good question. On the website, it should tell you. I don't know if does it tell you. Well, I can tell you right now. Yeah, the prizes will be announced. The judging starts actually next week, but the announcement when they're finished with the judging and they announce it is going to be on the day of Eid al-Adha. Eid al-Adha.
Oh.
Yeah, that's.
So when it's Eid, we get the prize, and there is a second Eid, so it's in 10 more days.
Actually, after Dhul Hijjah starts, it's 10 days after the start of Dhul Hijjah, the month of Dhul Hijjah on the Muslim calendar. Okay?
It seems like it'll be in 2 weeks from today, Friday. 2 weeks from Friday, but we don't know yet.
Yeah, that's the estimation is exactly 14 days from right now. So if you want to mark that on your calendar, you can do that. That's when the announcement will be made. And then the distribution will start the following Monday. And they'll start mailing out everything and contacting everybody to the winners and talking with them. So, yeah. Inshallah, you'll be a winner because you are. If you upload, you get a prize.
Yeah, and I'm the first caller, so I might get the $1,000 one.
Oh, you're not the first caller. You're the first caller today.
But you have to make a video.
Yeah, and you also have to have a video up there. It doesn't matter who's first and it doesn't matter who's last. What matters is how good you recite the Quran and understand it, and then be able to, the judges will judge that, not me.
And actually, if you don't make it, you still get a prize. My dad told me that.
Well, yeah, of course. You get a prize because you entered and you uploaded a video. All the prizes are based on that. You get a prize no matter what. Then, of the top 11 reciters, there is one who will get $1,000, 10 will all get $100, and then everybody else will get a nice prize. So definitely you're going to get something, okay?
Inshallah.
Inshallah. I like that you said inshallah. I like that. MashaAllah. Well, I'm so glad you called in, and I'm glad that you're talking with us right now. I think this is fantastic. Do you want to go ahead and start uploading your video, make your video and upload it?
Yeah, we're gonna do it today.
All right, I'll let you go back to doing that, all right?
Alright. Assalamu alaikum.
Wa alaikum salam rahmatullahi wa barakatuh. MashaAllah, MashaAllah. Sister Kim, are you still with us?
Yes, I am.
All right. We're very happy that you're staying with us. And did you hear our young friend who is 8 years old taking care of his parents?
I did hear that.
Both of them are sick right now, and he's taking care of them. And he has a little 2-year-old sister, and he's taking care of her too.
And he's living in the basement.
And she's running around breaking things.
MashaAllah, he's such a good son and a good brother.
New shows.
Yeah.
New shows coming. New shows coming.
Oh, yeah. They're reminding me to tell everybody we have a whole new series of shows coming on very soon. And we have another caller. Let's take the caller. Oh, we can't because it's too late. Too late. Time to say Salam alaikum. Salam alaikum, everybody. Stay tuned and stay guided with
Guide Us TV.
Ah, yeah. MashaAllah, MashaAllah, MashaAllah. Hey kids, come join the fun and win prizes too. Guide Us TV is our voice all across America. But now your voice can be heard too. Reciting the Quran. Yes, kids recite Quran, record, upload, share, enjoy, and win big prizes. First prize is $1,000. And the next 10 each get $100. And everyone who enters wins a gift. And it's all free. No ads, no big companies, no spam.